Hello everyone, this is Dr. Khan. So I have like a spontaneous Facebook Live, if you will, from one of my patients. She comes to me with a patient that I operated on just yesterday. And this is the one where we had the 800cc ruptured implant on the left. And then basically, you know, as you will see, she is a former patient of mine. She came to me a year ago, and we want to hear from you directly. So please tell us about your journey, about how you ended up getting implants.
Well, I was diagnosed with breast cancer in 2014. Prior to that, I never would have considered putting implants in. I was very small-chested, and of course, not to say I was steered that way, but you know, they pump it up like, oh, you can have whatever size you want. So I made that choice, and of course went through chemotherapy for a year and immunotherapy. So when I started having side effects, for me it was chronic bone pain in my right hip and legs. I immediately attributed to the chemotherapy because of course bone pain is a side effect. So never once in all the treatment that I got, either oncologist, plastic surgeon, the oncologist even sent me to pain management doctors to treat this pain with narcotics, which barely even touched the pain. And not one of them suggested, hey, it might be your implants. And of course, when I had my bilateral mastectomy, they put in expanders so that you can get the volume that you need. So who knows if it was the expander, but had a first set placed. Those were like a teardrop shape that were very uncomfortable. So those didn't stay in long.
What year was this?
This was 2014, December, yep.
Yes.
And
so you had the tissue expanders, the muscle was expanded. And then you had the teardrop in 2014.
Yes.
Yep.
And I didn't tolerate those long. They were very hard and uncomfortable. So I had a swap out the following year. And he replaced, another plastic surgeon replaced the teardrop with a round silicone. And of course, you know, they always tell you to go bigger just because, so you don't regret it, you know. That's kind of what you're encouraged to do. And had a right capsular contracture, so also had issues there. So they've been problematic from the start, to be honest with you. So
right now you and I talked, and then in 2023 you got an explant.
Well, funny enough, I'll tell you the story about how I found out about you. It was over Christmas break, and of course I'm feeling terrible. In hindsight, I filled out the survey. I fell across breast implant illness by accident. I came across a YouTube video of Danica Patrick, and I thought, gosh, here she eats impeccably, she exercises like crazy, and she's not healthy. So I thought maybe it's my implants that's causing the bone pain mostly. But then when I looked into BII, I started check marking off all these other symptoms that I was having, and I thought, wow. And it just, a light bulb went on. So I thought, I'm getting these out ASAP. So through my research, of course, I find you, and that was my plan. I was going to do beyond block removal. But through my further research, I found out about a natural option of taking your own tissue, right? A flap, whether it comes deep flap from the belly or a flap from the thigh, and creating my own breast mount from my own tissue. So kind of that's the route I was going to go. And I had the consult with you, and you said, oh, you know, there's great folks in Texas that will do that for you. So that's what I researched. And my first consult was with a high-named surgeon in Dallas at a university there. And I should have followed my gut, because when I went in for the consult, he wouldn't allow a recording or a FaceTime with a spouse or someone else if you're there by yourself. And as you all know with BII, sometimes you don't have clear thinking, whether it's brain fog or trouble with memory. So having a second person there is kind of critical.
Yeah, two minds are always better than one.
Sure.
Three are better than two, because sometimes, and I will tell you, this is very important. When you go into a doctor's office and you have the word cancer reconstruction, sometimes your mind goes numb and you don't process. So it's always very important and good to take someone else with you, your best friend, your significant other, whoever it may be, so that when they do listen, that they're able to comprehend and analyze, because you are not in your right frame of mind. Now, having talked to a lot of patients, they're literally going through the process of, okay, what do I do next? And it's a matter of like being fed the information where the patient is not able to truly process
Sure.
the information. And this is very true, especially when you hear the word cancer.
Your brain
And
just
it
goes
freezes,
blank.
yeah.
So really I had a pit in my stomach because I thought, no, I couldn't record what he had to say. I couldn't put someone on speaker. And that was my first gut instinct that said, this is not the right doctor for you. And so part of what I want to share with you is that it's so important that you follow your gut instincts. And a lot of times when we don't listen, we run into problems. So that was my first thing that I ignored. And the plan, which I told him I was going to come to you and do the on-block removal all in one piece, and then do an aesthetic flat closure. And then I wanted him at a later date, whatever he thought was appropriate, to do the pat flap from the thigh to create the breast mound. And of course he said, well, we want to keep that tissue from your prior implant that's been expanded to use, so I don't want you to go aesthetic flat. I can take care of the explant. We'll do it all in one fell swoop. So I'm on the schedule to do that at their facility. And of course I'm scheduled last of the day. And I had a guardian angel that day because he was delayed. Came into my room and said he had to cancel the case. And I'm like, I waited here all day, you know, can you please just do the on-block removal? I said, I know you're exhausted. If you're physically capable, because it is a detailed surgery,
Absolutely.
I'd like to get the implants out at least right now, and then I can come back for the flap later. And he said, I could manage that, because I even said, you know, a note to you ladies out there, they'll try to scare you that doing it on block is some dangerous procedure. He said, you know, we can puncture your lung and it's da-da-da-da. So I specifically said, I want the on block. Do you have the staff here to take care of me if my lung gets punctured? Oh yeah, we've got it all. So he assured me preoperatively that he would do it on block. And so I said, as long as you're, you know, you still have the stamina to get through that long of a case. Well, clearly, in hindsight, looking at how quick the case went, I was suspicious. But he also had 2 residents, or what do you call them when they're in training, assistants. So I thought, well, 3 doctors, 3 surgeons maybe working on either side. They were able to do the on block just quicker because they had more docs involved. So I was waiting and waiting for the post-operative photos. And what came to me, I was shocked because I didn't see the picture of the table with the implant in the capsule in its entirety outside my body. And I immediately got that sinking feeling again, like, now wait a minute, this guy's a smart guy. So I said, did you send me all the pictures? Yep, those are they. So I said, well, the one important picture is missing that shows me that you did it on block. And he doubled down. He insisted that he did it that way, via verbally to my face, and then in the online charting. And the pictures he sent, which he didn't know at the time, I'm a recovery room nurse, and I have enough knowledge of the surgical field that the picture he sent, you know, it shows on the draping, you could see the trails of the silicone where they just pulled the implant right out. In other words, you're putting yourself at risk if you don't do it on block, because that silicone gets exposed to your chest. So even though I was adamant about him doing it that way, he still elected not to do it and then told me he did after the fact. So thank God we canceled the flap, because could you imagine? At a later date, I would have rescheduled with him and he would have done the flap on top of the old capsules. So, you know, maybe he thought, well, I'll take the capsules out when I do the flap. Maybe that was his thinking. But why didn't he communicate that with me at the time?
So the word, you know, as you came to me, you had informed me that you had already gotten the end block. And this is very important because I myself, when I listen to what your doctor has had to say, I say, why then are you coming to me? Because then that there has to be another source, because I am giving the surgeon and you the benefit of the doubt because you
Correct.
truly had the end block.
2 things. I had kind of a honeymoon period after the implants came out of feeling a little bit better. And obviously that's probably natural. And then the pictures, again, I just knew that he didn't do it the way he said. And then after that week or two period, I started declining with my health again. In other words,
How soon after the surgery?
I would say within a couple weeks.
Couple of weeks.
You know,
So
I
this
just
is very
didn't-
important.
Yes.
So this is very important. When you went in 23 to get the explant, what those symptom questionnaire checklist? How many of those symptoms did you have?
I was 30 of the 33.
Wow. Okay. So you had a lot of those symptoms.
Yes, sir.
Now, when this is what I have noticed anecdotally from my practice, so those patients that have undergone an explant and it is a partial capsule removal or an imperfect surgery, the patients have a period of time where they actually feel great, as if they have recovered and benefited from the explant. And then I remember you told me that
Exactly.
50% of your symptoms had been erased and improved, and that 50% of your symptoms lingered on, and despite you having had an block. Now this is where you and I talked, and we were at the understanding, I am going to go back in and then I'm going to remove anything abnormal, scar, inflamed tissue, or capsule that I would find. Now,
I do have to interrupt and say
Yes.
to you guys that when I met Dr. Khan in person and I said, you know what, I would love it if you went in and you didn't find any capsule, that he did what he said he did, and it's going to be a waste of time, except for, you know, I had flabs of skin left over from those big implants that he was going to remove as well, so it wouldn't have been a wasted surgery. But when I asked you, you know, oh, I hope you go in and don't find anything, I'll feel better about the medical profession as a whole. And you said, what? In all your years of practice, you've never gone in and not found capsule.
that is correct. And
So that is disturbing.
yes, and I will tell you, because, you know, if you listen to your words, because you were still hurting from your symptoms of breast implant illness, and this is me talking to my patients, because remember, you're not making this up.
Well, you start to doubt yourself.
Yeah.
Am I going crazy?
If you're telling me that 50% of the symptoms are gone and 50% of the symptoms linger on, that reaffirms to me that it is still the residual capsules.
Sure.
One of my patients that I talked to from Colombia, South America, she said, have you ever gone in and not found anything because of the complaints that I'm bringing forth? And I said, no, I have always found some scar tissue. And lo and behold, I remember your case, and I reviewed the operative record, that indeed there was capsule on the rib left behind. There was indeed inflamed tissue.
Not a
and
little bit of capsule, a lot of capsule.
capsule.
So
And a lot of capsule was left behind, and a lot of inflamed tissue. Now the proof is in what? The pathology. Because it showed silicone mastitis, inflammation as a result of the capsular tissue that was inflamed.
we'll dig this. The high-named surgeon, the, you know, lot of letters behind his name, I insisted that the tissue go away for testing. So I asked for en bloc, and I said, please send it out for testing. I said to him specifically, I don't care how good the tissue looks, send it out.
To pathology.
So post-operatively, guess what he said? Oh, the tissue looked great, so I didn't send it out. And then also, he was going to charge me like $400 to get my implants back. And I thought to myself, well, I don't want to pay another $400. I don't need them. Well, hindsight's 2020, because I find out that you have to have the implants in your possession if you want to be any part of a class action suit against the manufacturer. I don't know, you know, I knew that wasn't on my plate at the time, but it's kind of fishy why he made it a hurdle for me to get my own implants
So I will
back.
tell you the implants. So this is what has happened before. So I operated at the hospital, another the patient that needed to be done at the hospital. The hospital said, well, our policy is that the patient release a record. And believe it or not, I have my patients fill out a form, and it's as simple as filling out a form, and the implants are kept in a non-formalin container in the pathology lab.
Right.
And what they are doing is just collecting dust, lack of a better word,
Sure.
because they're literally going to be tossed away. They're not going to put the implant underneath the microscope and look at it, right? Because it's just an implant. And so there is no reason to charge, and I have to say it is wrong for someone to charge, because this is, there's nothing that the pathology department is going to do, or the surgeon. And the bottom line here is, there is no reason to not give the implants. Now,
I think it's his way of discouraging me from getting them and being a participant of any future lawsuit. It's almost like, let's get rid of the evidence, in my opinion. So, thank God that my surgery got canceled, and then I was able to come back to you, and I just, again, knew in my gut from the photos. And I want to tell people out there, whether you're a breast cancer reconstruction patient or you're an augmented patient, I think a lot of times these doctors are telling you that they're going to do an en bloc, but what they really do is they open up the capsule, they milk out the implant, set it aside, then they get your capsule out, set it aside, and you could potentially be exposed to the silicone like I was, because here at this top-notch plastic surgeon, he didn't know ahead of time that my implant was ruptured. So he opens up the capsule and goes, oh crap, as that oozes out into my chest wall. So how many of you ladies think that you've had an en bloc removal because you've got photos of here's your implants, here's your capsule, but like Dr. Khan is so thorough, in his operating room, on the towel, you see the date of your surgery, the initials of you, obviously no patient identifying information, but you see that these photos you're getting are actually your photos, because God knows what they're going to send you, right?
No, it is important.
You're
it
so
is important.
detail-oriented, plus your videos and your pictures.
Right. So I have to say, very important, you have to show, number one, the patient's initials. Remember, no HIPAA violation there,
Correct.
the date of the surgery, and then you have to write down your name as well, so that you're the one who did it. And then also the right side, left side, and then you have to do 2 sets of pictures and videos. So a set of picture and video of the cutting open of the capsule and the implant on the table. And number 2, more importantly, if you ask me, the chest wall complete. And as you saw, the entire chest, the rib, the entire chest, where you can see yourself that there was no capsule remaining behind. And this is where,
well, you as a surgeon can tell clearly what's healthy and what's not.
Yes.
But us lay people out there, you know, if your doctor isn't labeling those photos, you don't know if that's a patient from last week or last year, for Pete's sakes. So I'm seeing even on your site where people are, oh, I got my en bloc and here's my photos, and I'm like, no, that's the implant with the capsule next to it. Whereas you show the actual cutting of the capsule and getting out, and it's outside the body. So you are the only person that does it.
so
right.
you have to show the chest wall, because if you have a high definition video of the chest wall plus pictures of the chest wall showing complete capsule removal, that is the utmost proof. There is no other better proof. If you ask me if a surgeon has a track record of doing it perfectly in the manner that it needs to be done, like the case yesterday, like your residual capsules, the surgeon must openly accept that the BII exists, not rush through the surgery. And this is a surgery where the surgeon has to have the right mindset.
Sure.
And I will say this to you, what happened to you is, quote, what I will clearly say is the worst case scenario, where the surgeon goes in and it's a ruptured implant. Look, in 2015 and in 2023, just 8 years later, you had a ruptured implant. And look, implants do rupture. These were the nicer, better, safer gummy bears. And and this is where the en bloc is key.
Sure.
And this is where every surgeon has to assume that the implant is ruptured till proven otherwise.
Correct.
Because you don't want to be caught off guard. And the en bloc has to be done in a very systematic, thoughtful way. So in your case, the silicone ruptured, that you had to come here for a second surgery.
Yes.
To go through another recovery.
Yep.
And then I will tell you from my practice, from my technique, do it once, do it right, do it definitively, do it consistently. Yes, I had a real self-review. En bloc is not required on all patients, but how can you tell that you needed it or not?
You don't know until you know.
And
when
until
you're
you go
cutting up
into the
that
case,
capsule, yes.
So this is another lady from Midwest. She came in. Her surgeon said, you have implants from just 8 years ago. They cannot be ruptured. And she in a room like this, believe it or not, under local, the surgeon gave a local anesthetic and then made an incision and was pulling out the implant on the left side. And to his surprise, he's like, wow, these are ruptured. And the next thing you know, I did a Facebook Live with the other lady, and she said that she had silicone pouring out that night. And the next day when she saw him in clinic, 2 days later, the surgeon attempted to remove that capsule, and then she came to me for a third surgery. I did another.
So you can't afford to come to con. No, you'll end up going to 1, 2, 3 other if you even know that they did it improperly. Because I didn't know. I knew by my gut, but I didn't know. He could have put that flap over the top and hidden that capsule forever. No one would have known.
So you have to have the high definition pictures and videos, and this is the bond that you yourself. Now there are many patients that go in and say, I want a replacement, and again, that is a different concept, a different patient, a different mentality. In your case, you knew the implants were harming you and that you needed them removed.
Absolutely.
And you knew in 2023 that you were going to be essentially flat chested because you were hurting, because you had 30 of those symptoms of breast implant illness.
It got crazy. I was having cardiac arrhythmia, shortness of breath. I'm by no means fit, but I do, we have acreage and land and animals to take care of, and it got to the point where I had no energy to get out of bed. Shortness of breath. What's going on? And then my heart starts acting up. So all of that's resolved. And I think had the capsule not been removed, I mean, to me, it's just a sponge that's absorbing all the toxins or whatever's in those implants that we don't know what's in.
So the capsular tissue has in it the impurities and the toxicities.
Just soaks it up and sits there.
The inflamed tissue around the capsule has to be removed because it's inflamed and angry. Because remember, it spills and leaches into the periphery. And then the other very important point here is that anything even remotely suspicious needs to be removed because we don't want to second guess and potentially say, oh, we wish we had removed that or not. And tested. So that is very important. When you had your surgery done, just like with every surgery, all of it is removed and all of it is tested. Tested meaning that sample goes to pathology to make sure it's not that rare VIL, CL, CD30 analysis is done. You cannot tell by looking at it with your eye as a surgeon that if it's cancer or no cancer. And the second thing is cultures are done for bacteria and fungus. Now,
and I specifically asked for not only bacterial cultures but fungal. So nothing was done that I asked to be done.
Yeah. And I will say it is proof as well. There are some patients that I talked to with residual capsules, and I asked where's the pathology report, and then they state that there was no pathology because that specimen, that capsule in itself is proof as to how good your surgeon did. I see, unfortunately, reports and videos where the surgeon said that they did an end block and you see holes through that capsule, or the capsule is like 3 by 3, very small, and the implant was 600. So this is clearly partial capsule removal. It is wrong and improper to cauterize or burn that capsule because that's not the same as removing it. Removing it means, and this is the take-home message, that the fascia of the intercostal muscle is removed, fascia of the serratus anterior, pectoralis minor, periosteum, and the perichondrium, that's the layer directly on top of the rib, such that there is no doubt that all of that inflamed tissue is removed and that all of it is tested.
So basically, you're willing to take the time to do all the work. It's not, and I've also heard out there that people need to search out microsurgeons that have some special talent to do an en bloc. All you surgeons go through the same training to do this. Everybody's capable of doing it. It's whether or not they will spend the time to do it as thoroughly as you do. And that's the answer. They can spend that 5 hours putting 5 sets of implants in and make a ton of money versus spend 5 hours doing the detailed surgery that you do. And then, to have someone who's a highly skilled surgeon like mine, prior one was, to say, oh, I forgot to take the one picture that would prove it was en bloc. It's like, I know you're smarter than that, right? So, that really, of course, coming to you originally would have been the best thing. But again, I went on to this deal about a flap, and I want to kind of go towards that briefly, not to change subjects. But in my research, I thought, okay, after Dr. Khan does my aesthetic flat closure, if I decide to do a flap down the road, I could still do that. So I go to another consult, a big practice in San Antonio, and I find out, because I mentioned to the doctor that I want to get all foreign material out of me. And he said, well, if you do a flap, we use over 100 titanium clips to do the anastomosis, which is the clamping of the vessels, etc. So I thought, why in the world? I got all this out of me. Why would I do a flap and then have potential metal in me that I could react to again? So I elected to not go that route at all. That's an important key factor that, again, 3 flap surgeons later, I had to luck upon someone who told me the truth about the titanium. So important for you ladies to make sure you get a surgeon that's going to do what they say they're going to do. Offer photographic evidence, even if, you're the only person that does it. All these guys can promise you that, but God forbid you're still out there hurting and symptomatic and you think you have had a non-block removal, there's a good chance you still have capsule left, sadly. And mention what you found in me. There was leftover suture and
Etherbound suture,
clips.
yes, yeah, clips. And then you also had fluid.
Yes.
So it was all contained. That was sent to cytology. We rolled
Yes.
out the BRBIALCL. This is a year later almost.
Yes,
Right? Yeah.
yes, October.
Yep, so you had fluid within your chest that I sent, and this is where anything abnormal, be it fluid or capsule, inflamed tissue, foreign body like ethebone, all of that is completely sincerely removed such that only good, healthy, viable tissue
Yes,
remains
sir.
behind. And you have the pictures and the videos to show, and
And peace of mind.
And
You've
the peace-
given me peace of mind that no one else can give. And, you know, like you say, do you spend the money on a surgeon? A lot of gals will say, well, I don't have the money to travel, or I don't want to deal with the travel. And, you know, you end up paying 2 or 3 surgeons and end up coming to you to fix all the stuff that was left behind by these other people.
yeah.
So
Now, question for
make the
you.
right choice from the start.
Question for you.
Yes, sir.
How after you had my surgery done, the last surgery, how good did you feel afterwards? Now, before you told me, these are your words, you had your surgery done in 23 and you were hurting, and
Yes.
this is when you went flat chested, and you were like, let's say 10 out of 10 bad, because that's when you said at least do that.
I was
implant.
desperate.
You were
Yes.
desperate, yeah.
Please get them
Because you
out.
said at least do that surgery because you had waited the whole day.
Mhm.
Now, when you came to me, you told me your words that you, like you said, 50% you were improved, 50% you were hurting, and you knew deep down within it was still the residual capsules, because that's like a big if.
Yes.
Now, after your surgery, how did you feel after my surgery with me? How did you feel afterwards?
Well, I don't know where to start with that because there's so many. There were even things that weren't on your list that have resolved that are odd things. But, you know, just visually from the outside, my husband right away said, wow, I can tell you're better because my eyes had, the whites of my eyes had a weird color to them or bloodshotty yellow, whatever. I had rosacea on my face. I had a rash on my chest. And again, when I was going through treatment, you always find something to blame it on, right? Cancer patients anyway. So you attribute this symptom to menopause, early menopause. Sometimes people are kicked into early menopause after having chemotherapy. So I never just made connection to the implants, but the rash cleared up, the fatigue is gone, and miraculously, the one thing that I was so worried about was that right hip bone pain gone. So I was going to those pain therapy, pain management docs. They went so far, doc, it was so bad that they did a bone biopsy. Talk about painful. Dig out a piece of your hip bone and make sure that the breast cancer hadn't gone to my hip bones.
Yeah.
So that was my main concern, was the hip and the bone pain in my legs, and that was gone. I thought everything else is just gravy if the hip pain is gone, because that's really, it was difficult to fly, difficult to drive. I dreaded going to the grocery store, having to walk to the back of the store to get milk because I knew I had to go that much further.
Wow.
It was that bad. And then again, my husband, at first you start to feel good and you're like, okay, is this is this just a what's the word? Placebo effect, when you think, okay, everything's out, I'm feeling great, and I was kind of waiting for the shoe to drop, right? Like, I'm feeling so good, but this can't be real. The pain will come back or something. I thought, I'm crazy, second guessing myself. And so I even said to my husband, this is for real. I mean, I had to convince myself and have his feedback.
What would you say
for real? The hip pain is gone.
Now, it's been gone for a while.
Well, on the year out, and it was, I should have kept a daily journal of things that I noticed over time, but again, the bone pain was the most severe, and the fatigue and all that, all these other things, have resolved as well. I've compared my symptom list to now, and so for me, it's been a complete recovery, like 100%. So I'm amazed, and I even said to my husband, I guess I didn't realize how sick I was until you get on the other end of it and realize what a blessing you've been in my life. I can't tell you how grateful I am that you do what you do, because I know there's a lot of people out there suffering, and I just hope that they get to the right person, A, to do it the right way from the get-go, or B, if they're still struggling, know that there's help out there. It's worth the money to invest in your health, and you've got to go to the right person. And trust me, I spent from December, Christmas, till March of the next year doing nothing but research to find who I thought was the best of the best, and I was deceived, and I think things worked out the way they were supposed to in some weird way, to where, thank God that case was canceled that day again, because I could be in a bigger problem with a flap on top of disgusting capsules underneath. So my guardian angel was looking out for me that day. But I'm willing to answer any questions or help anybody out there. I started an email for anyone out there, and I said, just say no to implants with the number 2 at gmail.com. So if you have any questions for me or what I've been through, if you want questions answered, please reach out, because I want to turn around and help the next person that's struggling, because it was devastating. And I'm angry because I wasted 10 years of my life from 2014 to 2024 being very sick and in a lot of pain. So it affects your life, your family life, you know. It was devastating, and I kick myself for making that choice. So that's why I went with it. Just say no to implants, because I think the surgeons aren't going to help us. Whatever doctors, we have to advocate for ourselves, do our research, and realize that everything has risks. And I think the science is not catching up to, you know, who's going to do the research? The implant manufacturers? No.
You know, see, the ultimate question here is this: how important is it to remove the capsule?
It's critical, because to me, I don't know what's in those implants. No one's going to tell us what's in them. And so that capsule is your tissue, and it's just sitting there absorbing whatever is in that implant. Implant comes out, that stays in. And like you say, if my friend who had the rupture, any plastic surgeon would have just taken out the ruptured implant, left the disgusting capsule behind, and put in a new implant right on top of it. So you've had patients that have had multiple capsules left behind.
Absolutely. And this is it's the whole surgery is about the capsule and that inflamed tissue around. Anyone can remove implants. That is a very simple, easy operation. But it's all about the capsule, and the whole capsule must be removed wholeheartedly, loyally, religiously. That the whole
But it's time consuming and
it's
difficult.
time consuming. It is a 5-hour surgery. Like yesterday's case, your friend that came with you, 5.5 hour surgery, and this is what it takes. And every stroke of that bovie has to be done in a very delicate, consistent way, because you can see the capsule is super thin, and it doesn't take much to cut into the capsule and now force out the silicone. And so it's all about the capsule and the.
But doctors are scaring patients and telling them, oh, you know, en blocs aren't required, right?
Yeah. So this is unfortunately, if you look at the federal government of Canada, they got a consensus by the plastic surgeons that the capsule does not have to be removed. It's a tedious operation. It's an expensive operation.
And you could puncture a
and
patient's
you can,
lung.
but I will tell you, in the
it.
right hands, this surgery can absolutely be done safely, definitively. Now remember, a surgery, even a colonoscopy, is an involved operation. Does it mean not to do a biopsy of a polyp? No, it has to be done, and it has to be done. If there is a cancer around the pancreas, that Whipple procedure is a very involved surgery. It has to be done, and they are associated. Now, I will tell you, this is still outpatient surgery, very well tolerated. The blood loss is less than 5 cc's in well over 99.5% of the patients, and the patients do very well. Look, your patient from our patient from yesterday.
Well, I'll tell you my experience, because I got to watch your video, which of course, you know, you're looking at your own surgery. I wasn't really prepped to watch that, so I've only recently watched that. But I knew it was me because I have a distinctive marking on my chest, so I knew, okay, it's the right surgeon, the right day. Those are my initials, and that's me because I have that mark right there. And as you were doing the case, I'm in the background. I mean, just snoring so loud.
Now, you're a recovery room nurse. You are a recovery room nurse, and you will see. Not a
the easiest recovery. I mean, there's no question. You know, at first I was like, well, you know, I'm so used to general anesthesia being the norm, and clearly that's it's not needed. Why do something if you don't need it? Do the minimal anesthesia required to
And
to
you
keep
have
the
that
patient
next level
comfortable?
up available if needed.
Correct.
Because you can always go the next level up. And to date, not a single patient has had any recollection of the surgery. And certainly the surgery can be done very safely and wisely and
Yes,
completely.
and you're also close to a hospital in case you need it. I mean, he's moved locations, but you're smart to do both locations near a hospital in case, but you've never had to transfer anybody out. So, you know, the facility here, I can speak from experience, is top notch. The old place was wonderful, the new place is wonderful. The staff's incredible. It's just been a pleasure from start to finish. And there's a colleague of yours that, you know, she's a fantastic surgeon in the same realm, but I had difficulty getting their office to even call me back. So even my friend yesterday, same thing. We laughed. We got back from her surgery yesterday. We're sitting in the hotel and ding, there was a voicemail from this other surgeon's office like a month later. She had her staff return the phone call. So your staff's incredible. Your intake smooth. I mean, everything start to finish. I have to say, I'm just overly impressed, and I'm not blowing smoke.
No. I will tell you, we have only one purpose from myself. It's top down and bottom up. We have only one interest: to take care of you 100% as if you're a family member,
Yes.
and to the best experience you can have. And you know.
On that note, I wish I could have asked the prior surgeon, hey, if I were your wife on the table, would you have done it the way you did it for me, or would you have done it en bloc correctly? Because I'll bet you money, had it been his wife, he would have done it right. You know?
You know, I will tell you, the unfortunate reality of the situation is this, because I talk to a lot of plastic surgeons.
Yes.
Vast majority of the plastic surgeons don't believe in the en bloc. They don't believe in breast implant illness. They don't want to even hear the word, or let alone utter the word breast implant illness.
It's called plausible deniability, right?
Yeah.
If they don't pretend they don't know, then they don't have to be, you know.
Yeah, and so now unfortunately they're not sold on the
Responsible.
idea. If you told them to put another set of implants, you would have gotten that in a heartbeat. And unfortunately, still to this day, this whole concept of informed consent,
Sure.
correct? Because you made the decision yourself.
Sure.
You were going to get them removed, not replaced. Now that was a big decision you made back in 23, because remember, you had
Yes.
not even seen me then.
Correct.
You could have very well opted, you know what, I'm going to get
Put
a
a new
smaller
set
one.
in.
Yeah, let's go ahead and get a new set. It's been 10 years, and this is where you made the decision, and it was an educated guess, and thanks to Danica Kirkpatrick that you were
Yeah.
able to put the two and two together. And I'll
Well,
tell
then
you,
you also you had something on your Facebook page about the black box warning from 2018 or 2019,
19,
don't quote me, 19, that has the black box warning on the implants. Now, the black box warning on a product that the patient never sees, does that make any sense? You're gonna put a warning on the box that the patient doesn't see. The box gets shipped to the to the surgeon, right? And you don't even see the box. It probably comes out in pre-op procedures. So it's like,
so this is
so dumb. Like,
so remember the truly, you know, I would say two things, and you know, number one, the black box warning should be discussed with the patient at
Yes.
the time of that informed consent,
Yes.
when your significant other should be listening in and saying, well,
instead it's in a 10-page
Yeah.
thing of paperwork
yeah,
that
so
nobody
and
reads
the
anyway.
surgeon is
Sign.
the surgeon is obligated in discussing, and this is part of
Never
that. This
happens.
is number one, they're not lifetime devices. The longer people have them, the higher the chances of complications, some of which will require more surgery, the PLLC. The third point about the joint pain, neck, back pain, all these problems
Those
of
conversations aren't happening. Dr.
unfortunately,
Khan.
and that is a big problem, because now the implants are being sold as they're nice, safe, good, and every patient, be it breast cancer or not, deserves it, because you deserve the best. And this is where the patients are unfortunately misled, misinformed,
Well,
or
not only
uninformed.
Yes, not only on that note to say that it's not a lifetime device. You know, if you make a selection to have implants put in, even if you're an augmented patient, us reconstructive patients, we kind of know it's a multi-step, multi-surgery. They kind of warn you you're going to have, right?
Right,
Different
exactly.
steps. But to an augmented patient, you might think, oh, I'm going to get my implants in and I'm good to go for the rest of my life. No, the chances of rupture, the chances of a capsular contracture, which I had as well, are so high. So just know your chances of having one procedure being one and done, good luck with that. And then if you have any complications, So don't assume that that's a lifetime device. I was told, oh, they last about 10 years. Well, mine didn't make it that long.
Yeah,
So
and you had a rupture in 8 years.
yeah.
So I will end with this. There are 5 things that one needs to be aware of that kind of authenticates or gives you that confidence, and it's going to kind of wrap up all what we discussed. Number 1, the surgeon must return the implants to the patient. It must be very proactive,
Yes.
not put financial blocks
Correct.
or blocks that you cannot. Remember, they were inside you. You certainly can hold them in your hand.
Yeah.
Number 2, the diameter of the incision, especially those patients who have had cosmetic reconstruction, the diameter of
Is
the
gonna
implant
be
dictates
wider.
the length of the
Mhm.
incision. So if you have a small incision and your implant was 500 or 400, you
They just
cannot
milked it out.
you cannot remove the whole capsule. Number 3, you need to have high definition pictures and
Mhm.
videos of not only the chest wall, but also cutting open of the capsule on the table with the patient's initials, the surgeon's name, and the date written on it.
Yep.
You know, I will say this, you know how you see the hostages in the past, they would have a newspaper,
right.
so you know it's the date.
Proof of life,
Proof,
right.
yeah. Number 4, you have to have the pathology sent, because that way you know what was removed, what were the dimensions, because any pathology department will look at and measure and say what was the size of the capsule, because that tells that is proper documentation of any pathology department to process any samples, so
Sure.
that we know. And number 5, your surgeon needs to be actively discussing on social media like today
Sure.
what is the goal of the surgery, what's the purpose, that he truly believes in breast implant illness. I have had a patient that went to another surgeon who did her surgery, and he would refuse to write that the diagnosis is breast implant illness. If you're not a believer in breast implant illness, how are you going to even do the surgery that is
Right.
meant to do the end block? And you
Well, that's what's happening.
yes.
I think they're on this new wave of Explant, and they're going to take your money and say, oh yeah, we'll take those out, no problem. But they're not going to acknowledge your symptoms or BII or do it right so that you rebound. So now they can send you, take the implants home out, think about it, and you still feel sick, so they can say, well, see, we took your implants out and you still feel crappy, so it's not a cause and effect. Do you get what I'm saying?
Yes,
like,
yes, yes.
they're wanting to not set it up to find the truth. They're basically, you know,
So-
perpetuating the problem.
So your surgeon, like one patient came to me and she said to me, just remove my implants. I don't want you to remove the capsule if they're thin enough.
in the
No,
world.
I
Yeah.
said to her, I'm sorry, I'm not your surgeon.
Good.
And this is where the surgeon must step up and say, remember, it's all about the capsule and then the inflamed tissue around, because you do not want to be then second guessing yourself, your surgeon, and your surgeon needs to wholeheartedly. Actually, I say this to all the listeners. Go to your surgeon and say, I don't want an end block. And I want you to go ahead and remove my implants,
And
whatever,
leave the
and
capsule?
leave. And then if he says, no, you must
You'll
remove the
find out if
capsule,
he's-
and you will find out definitively.
That's so smart.
No, because you know who
That's
told
really
me this? This is
smart.
another patient I talked to.
Mhm.
She said this is what I did with the other
He'll
consultant.
show
and
you
I-
his cards, whether
Yeah.
he's a believer or not,
yeah,
to
yeah,
get
and
it
then
out.
that way you will get it out, and you will hear it from your heart. And
Oh my.
one thing that I
Great
liked
tip.
was, because that way you will know definitively. And I will tell you, I wish we could just remove the implants, and I promise you I would do 10 of these in a day.
Sure.
Right? Because
Sure.
that's how easy it is to remove implants. But I will tell you, there is a certain etiquette, a finesse, a mindset, and not everyone can do the surgery, because for 5 hours to be fully focused and
Sure.
meticulously, just like the case yesterday, the Facebook Live from December 4th, I request everyone to watch it. You will see for yourself the intensity of the surgery. The 800cc ruptured implant, just from 10 years ago, your implant was ruptured 8 years into your
Yes.
augmentation. These are devices that need to be monitored closely, carefully. If you have symptoms, you need to get the workup. Ultimately, the MRI without contrast is the gold standard. If you look at the Mentor advertisement, they tell you at year 3 of the augmentation, then every 2 years they're onward.
That's
you
not
have to-
getting told to the patients either.
and even if they're told, no one's going to do it because they're too busy with their lives. And
Sure.
insurances are not going to cover this. And the bottom line here is, the last message I want to give here is, should not be a surprise for anyone who has implants.
Right.
You need to have known about this before you got them, that they're not
Informed
lifetime
consent.
devices, that they're very rare association with the lymphoma, that the BII exists. Not everyone will get BII, but there are patients who will eventually get BII, a rupture, contracture.
I feel
whatever.
guilty as a nurse not knowing what, because now that I look back, I see articles dated in 2014 and newscasts of blips of BII, and I'm like, how did I miss that? Of course, you can't catch everything on the news. You can't. So that's why I want to reach out to you ladies to say, you know, in case you missed it,
Yes.
right? Because I did, and I feel guilty.
No, and this is very
So-
healthy professional discussion. Just saying, implants, you have them, just know that these are the risks, and if you want to get them out, this is how you want to get them out. You don't want to be in your situation
Right.
where you have to seek another surgeon out.
Well,
and
God
go
knows
through
how long things progressed. They were getting worse and worse through the years. So had I not done it when I did, who knows where things would have ended, right?
Yes.
Continued to get worse. So know your body, follow your gut. If you feel like there's a connection, you've got to go to the right person, someone who's going to be thorough, and obviously getting them out in one piece, because now, I was exposed to all that silicone, and I don't, when you go in there, are you able to see any kind of remnants that were there left behind from the first surgery, silicone wise, or does my body just absorb that?
So
or
what I removed was, if you look at your
the
pathology report,
the tissue
it
that's
showed
bad.
silicone mastitis, it showed
Gotcha.
inflammation, and that
Yeah.
is the ultimate proof is you, because clinically you're exhibiting and you're telling freedom from that 50% of the symptoms of breast implant illness.
100% better.
And this is the whole purpose of today's Facebook Live. And then the
Don't
other
wait.
proof is what is in the pathology. Now the pathology is not always we're looking for inflamed tissues, but in your case you had the silicone mastitis, the inflammation as a result of the silicone toxicity, and this is what your body is reacting to.
Well, you're my angel. Come to the right person right from the start, and we're so grateful for you helping us. Thank God for you. You're our angel.
Thank you. It was a pleasure for you. Thank you very much for sharing your
And your
journey.
staff.
We want to enhance everyone's surgical experience. Thank you very much, everyone.
Thank you,
We
and
will
God
go ahead
bless.
and switch off. And please feel free to ask any questions. We'll do another Facebook Live soon.
Thank you.